thank you to Oscar Crane for letting us have a slot here, and also thank you to colleagues at Qlik IT for asking us to come along and talk about our journey so far. Like the previous speaker, I must hasten to add that we feel, although we've done a lot of good work over the last year, we feel we've got a lot more to achieve and a lot more to accomplish, and a lot more of exploiting the business intelligence tool Qlik Sense that we've just rolled out at Moorfields. But I'm happy to be able to share some of the work we've done so far. Before I move on, I must just say there are 3 names there, and there's only one of me. Andrew and Chris, for various reasons, haven't been able to join us here today, although I must just acknowledge the hard work that they've all done in terms of rolling out this tool, both from a technical perspective and also a project management perspective as well. So I must just acknowledge that they were very instrumental in this project. So moving on, a brief outline of what I'll cover in my presentation. A little bit about the business case, although I won't really go into too much detail about procurement and so on. That's a different topic altogether in the NHS. Our approach to migration. Unfortunately, we haven't got the Wi-Fi connections here to be able to go into some of the applications live, but Barney and colleagues are outside there to be able to demo the Qlik Sense tool for you if you are interested to see it in action. We've just got screenshots here, I'm afraid. But I'll talk through some of the applications that we've developed or migrated over and developed. Of course, every project has its challenges, so I will mention a few of those, and I'll just briefly touch upon some of the future aspirations we have with the tool. So firstly, just to give you a little bit of an introduction to Moorfields, I think most of you will know that Moorfields is one of the most reputable leading provider of eye care services in the UK. We also have a very well-developed and well-known research and education arm. I think these are 17-18 figures, and we employ about 2,350 staff. I think that's slightly higher now. Our geography, many people aren't aware, although we have the City Road hub where most of our activity is carried out, and particularly the complex activity. We do have settings across London, and as you can see from that map, we go as far up as Bedford, although Bedford isn't our activity. We loan our consultants to Bedford, but we have a considerable activity going on up there, down to Croydon in the south and Darrant Valley. So a mix of sort of surgical or outpatient activity, but we do cover a lot of the City of London. But of course, being a specialist eye provider, we do get referrals from all over the country, so we have relationships with a large number of CCGs. Many people aren't also aware that we have Moorfields in Dubai and Moorfields in Abu Dhabi. Dubai opened 10 years ago. I believe last year we celebrated the 10th anniversary of Dubai, and Al Jalila in Abu Dhabi opened in 2016, and they're doing very, very well, but we don't get any of that data feeding into our Qlik Sense just yet. So what else to say about Moorfields? Okay, so some key figures, again, ending at 17-18 there. As you can see, being an eye service provider, most of our activity is day case. We don't have very many beds. In fact, we only have 6 beds for the NHS in the City Road hub, and 6 beds in the south, and the private setting have 6 beds as well in City Road. Oh, and I forgot to mention we do have Moorfields Private that's just behind the NHS setting. So most of our activity is day case. We do have a very busy A&E. We can see up to 250 to 300 patients on a daily basis in our A&E. And of course, we have a very busy outpatient departments across all of our services. Our activity grows at the rate of about 2 to 3% per year. Okay, so moving on to why we migrated to Qlik Sense. We had QlikView, that was our main electronic management information system, so another product within the Qlik suite. I joined the trust about 2 years ago, but we've had QlikView perhaps about 5 or 6 years before that, and it served its purpose. It was in the trust for a long time. We used it to collate and present a wide range of operational, organisational data and reports to our users. However, I think by admission of my own team, a little bit of self-sufficiency, complacency set in. We were finding ourselves several iterations behind the latest release. And what horrified me when I first started at Moorfields, that every single application was developed with a different design, a different look. You could tell which analyst had built it, but they'd gone away and done their own thing. And so you sometimes had filters in the top left corner, sometimes you had filters at the bottom, sometimes you had filters to the right. So there was just no consistency in the way some of these reports were designed. But as I said, you know, it met the purpose, and we had a large number of users. But what it didn't do is it didn't attract staff to use the product for presentational purposes or dig deeper into the data. I mean, to be honest, a business intelligence tool like Qlik Sense or QlikView is for our customers. We have enough technical knowledge in the team to be able to write SQL script to get access to the data, but it's something that we provide for our users. So, and for me especially, I mean, I very rarely have time to go and write SQL scripts, and so I need access to a tool like this, and it just didn't do it for me. And we were also working on a very old licensing model. It didn't really take into account an effective and flexible way of providing user access. So it was at that point we sort of put our heads together and thought about how we can expand usage of our reporting tools, how we can make the lives of our operational managers, our nursing staff, other clinical staff around the trust easier, and how we can get them to actually better dig deeper into their data and understand their services a little better. So it's quite opportune that at that time we had a visit from a Qlik consultant who talked us through the new tool, the Qlik Sense tool, and talked us through some of the benefits of the tool. And we can immediately see from that very initial meeting, although we did have subsequent meetings, that the product ticked off a lot of what we wanted to do, how we wanted to expand, how we wanted to increase coverage of usage of the tool. So a lot of what we aspired to was just coming out quite quickly. Qlik Sense is a non-device aligned tool, enabling the use of access of tablets and telephony platforms, so iPhones, for example, to be able to access reports. Although we're yet to explore that in a bit more detail, but that facility is there. The ability to construct bespoke and dynamic presentations that are designed by the users themselves. They can go away and bookmark and design their own presentation of their own analysis of the data within the application, and an intuitive drag and drop user experience for data visualization and exploration capabilities. The next function is something that is a favourite of everybody who's used it. It's data storytelling. So sometimes in meetings, operational managers will want access to views of several different areas. So whether that's RTT performance, whether that's cancer performance, whether that's A&E performance, or any other operational activity and performance. So data storytelling makes that very easy. We can link views with the filters built into one story. And of course, Qlik Sense also allows for a flexible token allocation. You can allocate tokens to customers that are either named individuals or pools of people, and you also have time-limited access as well. So you can issue tokens that are time-limited for those people that only perhaps go into the system once every fortnight or once a month. So a lot of what we wanted to do was ticked off by this product. So, just to summarise the main drivers for the change, the current product was in need of an upgrade. We needed to expand our user base with something more intuitive. We needed the ability for our users to create flexible, creative and attractive presentations of their data, so that they didn't have to export the data into Excel and then make it look pretty and then export it out into a PowerPoint presentation. We wanted to enhance data literacy. If you're an operational manager, you really need information at the tips of your fingertips. At your fingertips. So in order to get them to dig deeper into the data, have a deeper understanding of where the issues are, where the bottlenecks are, where the performance issues are, was something that is highly enabled by the Qlik Sense tool. and the stories I've talked about, and of course the future development of the mobile capacity is something that was very attractive to us. So then started the route to procurement, and as I said, I won't be covering procurement in any great detail at all. It's a minefield in the NHS, but we were able to directly award because we were already on the QlikView platform. So I put together a business case that went to our capital expenditure group, and we had a lot of buy-in from some very senior managers and directors across the leadership team to our aspiration to migrate over to Qlik Sense. So that made that process run quite smoothly, and then we partnered with Qlik IT and Partners and Procurement Service to then progress the procurement, and that went relatively smoothly in NHS standards, I think. Andrew, who would have been here, but he's a strong project manager, so we had a very much a project management approach to migration from QlikView to Qlik Sense. We had about 51, perhaps a little bit more. There are a few finance reports still sitting in the QlikView suite because they're provided by a third party who weren't ready to migrate over to Qlik Sense. So we've had to keep those aside in QlikView. But the remaining 51 or so QlikView dashboards, we carried out a prioritization exercise. A lot of my analysts did some user engagement with the key users of the existing reports, analysed what they do with it, what they really need, and so on. And we identified about 33 of the 51 that needed to be retained, or some amalgamated into one application. And then we then fast-tracked a couple of the analysts in my team and got them started on the migration process. And then over the course of the next 3 months from commencing the project, we had two blocks of 3 days of more detailed training for my analysts. And then they were ready to start the migration over to Qlik Sense. And of course, we involved our users in testing the migrated product wherever possible. Now, all of this had to be done in quite a tight time scale. We wanted to kind of be off the QlikView platform as much as possible by the end of March, and I think we started the project July, August of the previous year, and that was largely possible. I think we didn't rush it, so we didn't feel rushed, and there was a lot of user engagement to get us off the QlikView platform into Qlik Sense. But we didn't want to sort of say, right, my analysts are all trained in using the product and writing applications and developing new applications. We wanted to also train up our key users on the way in which they could easily navigate through the Qlik Sense application, because ultimately this is a tool that we're developing for them. So fortunately, in the business case, we had put in enough consultancy support, and we had enough consultancy days available to be able to work with Qlik IT to roll out some workshops that equipped our users with some basic navigation, and we used our own applications as training material. We didn't use anything that was sort of in a training manual. Some of our own applications were used, and they were equipped with these were 3.5-hour workshops, and they were equipped with skills on how to navigate the reports, how to edit an application, how to make selections, and how to create their own bespoke presentations. And as you can see from the list there, we covered a range and diverse set of functions, ranging from our comms team to finance, to primary care liaison, to information governance, and of course operational and quality and safety teams as well. We had extremely good feedback from these workshops. They felt it really helped them to go away and back to their desk and navigate our applications with a degree of confidence. And there were many staff that went away and promoted it to other staff, and we ended up having to put quite a few workshops on to be able to mop up the staff that couldn't make it to the first set of workshops. finance themselves, hoarded a workshop to themselves, and they are now thinking, in fact they're very, quite advanced in their thinking about rolling out an ISLR project, which I'll talk a little bit about later on, using Qlik Sense applications. And that would be great, because then operational managers will have access to their operational performance, their activity and their finance reports all in one application platform. What we also did was also develop an intranet page, which we will need to redesign, because our comms team are just about to start a project to redesign the intranet. But that's fine. We gave, on the intranet page, we made available links so that people who wanted access to the Qlik Sense application can request a link. We wrote some user guides on some of our key applications, and my intention is to have one user guide there for every single application. We built some links into forms, so if they wanted to change to a particular application, that was accessible to them from the intranet. And also if they wanted us to design a new application, again, there's a request form there, which is then reviewed by members of my team and prioritized accordingly. So that's an intranet page we built. Moving on. The one thing which I mentioned earlier was that our ClickView applications weren't very consistent, and I was adamant that we would want consistency of view of our applications. So we took advice from a Qlik IT consultant that we were working with at the time on branding. We spoke to our comms team about colour schemes. Are we using the right colour schemes, or are we deviating from them? We talked to them about the templates we should use as the sort of the thumbnail entry into the reports. And as you can see there, that's a slide of some of our operational reports, and they're all in the blue colour template, and again, colours that are endorsed by our communications team. The other thing we wanted to do was, and we adopted a Qlik methodology called the DAR methodology, Dashboard Analysis and Reporting, and as much as possible we've got that methodology adopted in all of our applications. So you start off with your high-level KPIs. You then are able to filter and get down to the services or areas that you want to focus on, and then you can carry on filtering and get down to the root of the area that you want to look at in detail. So that's known as the Dashboard Analysis and Report methodology, and there's a slide that I've kind of nicked from Qlik there that explains some of that. I won't read it in detail, but very much sort of you come into the application with a high-level view of key KPIs, which we've designed in consultation with our users. You then have your filtering, and then you go down to the detail. So that's the DAR approach that, as much as possible, we've adopted in our applications. So that's an example of a dashboard summary for outpatients. So there's no filters built in. It's pretty much showing everything we've got on outpatients, no time limits, nothing there. So people go into that and think, oh, that's not what I want. And then it then triggers them to actually go down to the filters page, or the filters built in at the side there to get down to the service that they want. The other smart aspect of Qlik Sense is the search functionality and the colour coding of associations between data. So as selections are made, this has a dynamic effect on other filters. So we've got here an example of a filter page where all of the possible filters that are listed. There's much more than what I've shown there. And depending on what you've selected, other filters will either turn grey or white or green. If it turns green, that means there's a direct association with in this case, the date filter that we've selected there. So I think that's Queen Mary's, yeah. So in this particular case, it's Queen Mary's, and 2017 has a direct association with all the services listed in white there. So all those months and that particular site is directly associated with all the services that we've listed there, and we have data for all the months that's listed there in white. If it's grey, or if it's a slightly darker shade of grey, the light grey means that there may be some association with a particular filter, but it's not a strong association. And dark grey means that there's absolutely no association with the filters that you've selected. Other methodologies for filtering, we have made that available on the analysis part of the application, so people can go in and select various variables such as financial year, month, site, service, clinic, and appointment type in this particular application, and those filters will clearly show up at the top of the screen so that they can see exactly what they filtered, and then they can bookmark that selection so that if it's a view that they want to go into on a regular basis, it's refreshed overnight and they go into the application that they've bookmarked and it's regularly refreshed. The other aspect of Qlik Sense that I really like is the smart search functionality, and that's particularly good if you have fields with a lot of free text in, or it's very useful to those users of these applications that perhaps don't, in my team, we know a lot of the sort of the HRG codes or the OPCS codes or the ICD-10 codes, whereas some of our users perhaps know procedures as the full name of the procedure or the full name of the diagnoses. This is called Smart Search, and once they key in the free text, it highlights all the particular associated selections that they can make, and then they can look down the list and say, well, actually, this is what I want. So then once they click on that, this will then take them to the report that they need to see. So using Qlik Sense to drive performance, as I said, we're very much at the start of that journey, but we have developed a number of applications that a number of service improvement projects are currently utilising with a great degree of success. So this is a particular project that our service improvement team have for improving outpatient journey times. What this has shown is that whilst journey times may look good, we have a data quality issue there. So they can then drill down to where the issues are, and there's some quotes there from our service improvement team about how they've used Qlik Sense to drill down to where the data quality issues are and improved on data completeness. So we are seeing our journey time going down, but we're also seeing our data completeness going up. And that's a demonstration of how they can actually go down to service and then clinic level to understand where the issues are. So Qlik Sense, again, with the trending of the data, they can see where they've made improvements and whether they're maintaining the performance against the required standards. We have built an activity plan monitor summary, which this time is color-coded, red, amber and green, depending on where we are against our plan. And this is an application that's coming in very helpful for our business development and business planning process that's we've just started. So very helpful there to go down to see where we are doing against plan. And again, you can drill down to services, sites and activity types. The next set of applications in a different colour this time, because it's for our nursing and quality and safety staff, and something we're quite proud of because we've had significant number of user engagement workshops to design some of this. And again, very much built on the same principles, dashboard, down to the analysis once you've selected some filters, and reporting. This is the first time we're making patient fall data, for example, available and accessible quite easily. Previously, the quality and safety staff used to have to ring up the nursing staff used to have to ring up the quality and safety team and say, can I have an extract of all my falls over a certain period? Now we're giving them that information at the tip of their fingertips. The nursing dashboard, we also monitor medication and incidents, and again, there wasn't a very developed reporting tool on our quality and safety system, but now they have access to that information. Nurses are also in charge of making sure that their staff are compliant with mandatory training, and again, this application gives them access to that information routinely. So just to sort of conscious of time. So various other views of the nursing dashboard, which we're particularly proud of because it has involved a lot of user engagement. Qlik Sense stories. So this has been a great success. So we have an RTT application, we have a cancer application, we have an A&E application, but one weekly access performance meeting. So we want to be able to draw in views of all of those areas into one report. So the Qlik Sense story makes that possible. Users can then export the data into Excel or PDF or PowerPoint, whatever they choose to use. But many of our operational managers sit in those meetings with Qlik Sense loaded up on their laptops. We have 3 divisions, City Road, North and South, and they're all looking at the same link. And when the Chief Operating Officer is talking about the North Division, they can filter onto the North and it all refreshes there and then. When they move on to the South Division, they change the filters to the South and all the same information refreshes there and then, and likewise for City Road. So this has been a great success story for us. And that's some views of what they see in their access meetings. And just to sort of demonstrate the before and after, we used to produce the same pack in Excel over a number of different tabs, and it used to take one of my analysts about half a day to produce that, and then another half a day for us to QA it and sign it off. Qlik Sense Story has made that available daily. It requires about 30 minutes of analyst time because there are some views that we're still trying to get into a Qlik Sense application, but it's not quite there yet, so we're having to export views in from other areas, but largely it takes no more than 30 minutes. It's used to be circulated via email 2 days before the meeting. Now it's available online in the meeting itself. And that's a quote from our Chief Operating Officer as to how easy it's made his weekly access meeting. Clinical coding dashboard. This is something I'm very proud of because it gave Moorfields a very good award, the CHKS Data Quality Award for clinical coding. For those of you who remember when HRG4+ was rolled out, we had to make significant changes to in the way we recorded comorbidities and complications, and monitoring that at service, clinic and directorate level made it very easy for the coding team to go out and have discussions with clinical leads in those areas about what they're doing to improve comorbidity and complexity reporting. So we have a couple of reports available for our coding team, A, on looking at the depth of coding, and B, on looking at measures like missed admissions, uncoded episodes, so that they can keep track of how well they're doing with the coding. So that's just a slide on demonstrating how we've improved on comorbidity recording for 3 particular comorbidities, although there's a long list of them. And there was a huge exercise to make sure those comorbidities were collected at pre-assessment stage, and we were able to monitor the uptake of that. So that's the award we won at the CHKS awards event for the quality of our clinical coding, and that largely looked into the depth of coding and uncoded percentages of uncoded episodes or errors in our coding, and we came out top last year. So we have a suite of other applications, and these are some screenshots of them. Obviously, I think most trusts have live A&E dashboards. Our Qlik Sense A&E dashboard is viewable in our A&E, and it refreshes every 2 to 3 minutes so that staff down there have instant access to information on how the A&E is performing and whether they've got any patients that are about to approach the 4-hour target. We've got a theatre applications and some data quality auditing. And again, data quality is something we take very seriously in Moorfields. And again, we're one of the top trusts with in terms of our sus submissions on the way we performing against data quality. So every project has its challenges, nothing different to whatever previous speakers have said. Staff roles change, staff move on, you need to retrain, user adoption. So I'm trying to get my team to, if they know that a particular member of staff has been trained and has navigated the application significantly, then they shouldn't be coming to us for simple requests. They should only be coming to us for complex requests. So that's a bit of a challenge, and we keep having to back staff or handhold them to develop their own views of the data as well. Obviously, protected time for new applications, the burden of reporting goes up year on year, and getting that protected time to take on new application developments is sometimes a challenge, but something I strive to make time for. Applications, one size doesn't always fit all, so applications that cater for all can be a challenge, particularly with our data sets. And the last one is, I think, a problem that's rife in most trusts, is the taxonomy and the nomenclature used across different systems. So whilst it's quite consistent across PAS and Open Eyes, which is our main clinical system, it's not so consistent in other systems that we're getting data from. So a simple example maybe where St Anne's is one of our sites, and I think I've seen that spelt in 4 different ways across 4 different systems. So that is a challenge for those of us that are trying to report on that data. But we are constantly raising these issues and trying to solve them at source. And very quickly, just future developments. We're not going to let ourselves get complacent and lag behind in our releases of Qlik Sense. Obviously, it's finding the quiet time to do those upgrades, and we've got one scheduled in for Christmas to bring us up to the latest version. Now that we've run several workshops and training material has been delivered for about 7 or 8 different workshops. My staff shadowed each and every one of those workshops, and we're indebted to Qlik IT for running all of those workshops. But I think we've gathered enough kind of confidence in being able to roll out those workshops ourselves now. So from January, perhaps every quarter, we will be rolling out our own workshops. We want to further explore the mobile telephony. Our finance team, I mentioned before, are very keen on using Qlik Sense for an ISLR project, and we're running out of time, but if anybody wants to find out more about that project, please do see me. We've got a new EMR hopefully being rolled out in April next year, and that will hopefully expand the usage of Qlik Sense by our clinicians. It's a group we haven't really tapped into too much yet because they're otherwise occupied, but we hope to be able to tap into that group later on. And of course, you know, generating ideas from coming to events like this. And our comms team are about to start a project on redesigning the intranet and the internet, and I really want to get in on that project to make sure that we can embed some of our Qlik Sense analytics into mainly the intranet, but also make some performance information available to our patients and users. So that's it. So thank you for listening.